Each patient's experience with fertility treatments is unique and may differ from the stories presented in this video. Patients should consult with their healthcare provider to discuss if fertility treatments would be appropriate for them.
I was the type of child that my whole life revolved around having children, and it was like I couldn't wait until I was old enough. So I figured by 25, 26, I would probably be married and ready to have children. And I remember asking my doctor, when I was a teenager, I had irregular cycles. Do you think this is something that is going to return when I get to the point where I'm ready to have children? And she said, worry about it when the time comes. And then we got married, we got a house, and the next thing was, okay, it's time to have kids. And of course, the same thing happened when we decided we were ready. From the time that we started trying until the time that I went to the specialist was probably about an 8-month period, I would say. And when it's not happening and you're watching everyone around you get pregnant, and I was depressed and lonely, and we did everything right. Why does this have to be a problem now? I think there's a lot of shame in infertility. It's almost like embarrassing. This is something that's supposed to happen naturally. And it was through looking on the internet and finding others who had the same hormonal disorder that I had. I saw this term reproductive endocrinologist, and I started researching more about that, and it just seemed perfect. The woman that greeted you at the front desk had the biggest smile on her face. She was just, happy to see you there. I just felt walking into that office that I was at a place where people wanted to help me. They were going to help me. Our doctor recommended starting off with treatments, which we did. We did the same treatment for a couple of months, and that didn't work. And then we tried a different treatment, and that didn't work. And then finally, she recommended trying in vitro fertilization, which had the best odds of working. We were fortunate enough for it to work, and we ended up with 2 beautiful, happy, healthy twins. I just feel grateful about the whole process. It was something that I wanted for so long, and as soon as I knew that there was something that could be done immediately, I didn't hesitate at all.
There are so many old wives' tales about fertility treatments. We're here to demystify all of that.
How do I know if I need to see a specialist?
So if the couple's been trying to get pregnant for a year, it's time to get some help. And if a woman's over the age of 35 and trying to get pregnant, 6 months is more than enough time before she goes and seeks some help.
I'm 31. Is that too old to have a baby?
Absolutely not. Women who are 26, 36, and even 46 can get pregnant. Usually when a woman is over 44 or 45, we have to discuss other options, up to and including donor egg. But a 36-year-old has a lot of normal eggs generally, and often very quickly conceives.
Do I have to bring my husband or boyfriend with me to the appointment?
Whenever possible, we like to see both partners come in for the first consultation because infertility ultimately is a couple's problem.
What are some myths about fertility?
One common old wives' tale is that drinking a lot of cough syrup is good because it could thin the cervical mucus, making it easier for the sperm to pass through. It turns out that that really has no basis in truth. The whole boxers versus briefs is a question that's been asked for years. It turns out that probably doesn't matter. But if a guy is spending hours and hours in a hot tub, then that will elevate the temperature of his testicles and it may impair sperm formation.
What are the risks associated with fertility treatments?
Possible side effects of fertility treatment and fertility medications may include mild cramping and or abdominal pain, mild bruising and soreness at the medication site, nausea, breast tenderness and increased vaginal discharge, mood swings and fatigue, and ovarian hyperstimulation syndrome, or OHSS. OHSS involves sudden ovarian enlargement accompanied by fluid accumulation in the abdominal cavity. This may occur with or without pain and with or without accumulation of fluid in the lungs. OHSS is caused when the ovaries become overstimulated by the various hormones that cause follicular development. Your doctor will monitor you frequently to help address these risks. Thank you for taking this tour with us today. For more information, please visit fertilitylifelines.com.